$2.4 billion will be spent on a medical health package to try and stop the spread of coronavirus here in Australia. Joining me now is the Royal Australian College of GPs President, Harry Nespolon. Harry Nespolon, good to see you. 100 pop-up clinics, is this a good idea?
Yes, it is a good idea because what we need is capacity in the system. We need to be able to get patients and people who are concerned about whether they've got coronavirus or not seen and triaged, and so the clinics will go a long way to help deal with those sorts of issues.
That and video conferencing will be bulk billed. Is that being done already? Will this expedite that process?
My understanding is that this will be starting on Friday, and it won't need to be video conferencing. You will be able to just telephone your GP, and so that's something that we've been calling for all along, to make it as simple as possible. Also importantly, the government will also be introducing a second item number, as we understand, which will enable patients such as people who are over 70 to be able to deal with their day-to-day medical problems over the telephone. And that's also going to be really important, trying to protect patients who are at risk of the severe consequences of coronavirus. So we need to congratulate the government for that as well.
You've been quite vocal on this for a number of weeks now. Were you consulted about what the government should do in terms of a medical response?
Yes, we've been consulted. As I said, we've been pushing very hard to make this as simple as possible. We want patients, Australians, just to be able to ring up their GP and get some advice. We'll need to wait for the details, but we're pretty close to that, and we appreciate that.
Where are the staff coming from to service these 100 pop-up clinics?
Well, as I understand it, they will be a tender, so there will be practices who will be able to tender, as in general practices, who will be able to tender for these clinics, and hopefully we will find that there is a good response, and that the staff will be there ready to deal with patients who do have concerns about whether or not they do have coronavirus or not.
What kind of support do GPs need? Are they already, most of them already set up to do video conferencing and telephone consults?
Well, telephone consults are as simple as the telephone. As I said, the simpler the technology, the better. In terms of being set up, it's going to be more about the practice and how they deal with the phone calls that they do get during the day, because there will be the usual, patients will still be coming in to have their usual medical issues dealt with, and so each practice will have to work out a system for themselves. $2.4
billion is a lot of money, Doctor. Where is the bulk of this cost coming from?
Well, the package, I understand, will be announced this morning, so about $600 million will be directed towards general practice, which we're very grateful for. A lot of that money will also be going towards, or some of that money will be going towards expanding pathology services, which is just as important as all the other services. But I understand that a lot of the money will also be used for aged care, Indigenous care, and a range of other different settings, and again, that's really important, that we are dealing with the most vulnerable people in our community.
It's never too late to enforce these kinds of things, but would you have liked to have seen this weeks ago?
As we've been saying for at least the last 3 or 4 weeks, the telephone item numbers will really make a huge change to the way that we're able to triage patients with coronavirus. It will help to protect patients and protect doctors and their staff. So, yeah, the sooner the better. Would have been, last week would be better than this week, but we'll take it. We'll take it this Friday.
But if this was done earlier, Doctor, could we have stopped the number of cases spreading here in Australia?
That's a much more difficult question to answer. I think what it would have done would have significantly decreased the anxiety amongst general practitioners and even the Australian community about dealing with coronavirus. Most people realise that if you might have the infection and you send people to a group or to a crowded place, that it potentially spreads. So, as we've been saying all along, we've always wanted to try and deal with patients in their own home or away from crowds.
Have GPs had the information available to them that they've needed? Has that come too little too late, and do you have it yet?
Well, in terms of the way that we manage the cases, Unfortunately, that's been sort of changing from almost day to day. The real concern has been that there have been a number of different sources, and as we've been trying to ask the governments, and at all levels of governments, federal, state and territory, that they do get together and just produce a single document rather than producing a Commonwealth document and a different state and territory document.
So that's caused some confusion, hasn't it, among GPs and therefore patients?
Look, it's caused a lot of confusion and a lot of anxiety because each of the states have different levels. So if you look at what happened yesterday, you've got one state saying go and test everyone who's got a cough or a cold, and you've got the rest of Australia saying unless you're at risk of being exposed to the coronavirus, then that's when you should be tested. And again, that causes anxiety. I mean, you know, patients are wondering, you know, am I being taken care of if you're in one of the states who are only doing the corona-exposed testing. But hopefully we will find over the next few weeks that improves. The Commonwealth the Chief Medical Officer of the Commonwealth has said that he'll be writing to GPs twice a week, which with advice, and that's something that we also welcome very much.
Okay, well, we wait for the detail later from the government. Harry Nespolon, Dr. Harry Nespolon, thanks so much for your time.
Anytime.